Welcome everyone to our Lunch with an Expert. This week we are very, very lucky to have Christopher Cheek, and he is a doctor of physical therapy, and we'll be talking about working from home ergonomics. He's joining us from Rehab United, and we've been trying to get somebody like this to come in and do more of these preventative talks. What we'll do is he's going to give his talk. It's about 30 to 35 minutes, and then you can put things to me in the chat box, questions as they come, but we'll answer them at the end, and we'll allow some time at the end for questions if we didn't get everybody's things answered. Thanks very much, Chris. I'll take it away.
All right, here, let me go ahead and start this here. There it is. All right, yeah, thanks for the intro. Thanks everybody for joining, whether you're tuning in live or going to be watching this on the recording later. Like Dr. Tess was saying, this is the Work from Home Ergonomics Seminar. I've given this a few times, actually pre-COVID as well. So I've tweaked a few things here and there, based on the pandemic that we've all been living through in the last 2 years. I think it makes it a lot more pertinent. A little bit about me. Like she was mentioning, my name is Chris Cheek. I'm a staff physical therapist here at Rehab United Seattle, which is located in Green Lake, not too far away from Green Lake Primary Care, just a hop, skip, and a jump. I moved here just about 2 years ago from sunny Florida, and I have really enjoyed the change in climate and the easy access to the outdoors, somewhere with mountains that's not at sea level. So I enjoy hiking, running, biking, and even just, exploring all of the lovely Seattle neighborhoods. And my most recent residency in school, I had experience under the tutelage of a certified ergonomic assessment specialist, which was a really cool side where I got to see, basically he did fitting for whether it was like truck drivers for big companies or people that just needed to travel a lot for their jobs. It could be like a Subaru was their work car, and just fitting them, like measuring their leg lengths, head heights, all that kind of stuff, which is a good thing to see. And I think I bring some of that expertise with me into the clinic. So that's a little bit about me. And I hope over the next 30 minutes, you are able to take home, at least 1 or 2 tips and tricks, things that you can do to modify, your home setup or whether you're at work. So we'll get started here. We'll start with a fun fact slide just to get into kind of the mood about talking about ergonomics and some of the things that revolves around that. This is from all of these stats here are from some recent research papers that I've been looking through. A most recent one says that we spend about half of our waking hours in the US sitting, whether that's driving, watching TV, working at your desk. So, that's quite a bit of time. If you take, somebody working full time for 40 hours a week and, for 40 years, that's quite a lot of time added up sitting. Excessive sitting, as I'm sure you all have maybe heard by now, it's kind of termed like sitting is the new smoking. It's been linked with increased risk for heart disease, blood pressure, diabetes, all of those sorts of syndromes. And unfortunately, the research shows that you cannot offset 10 hours of prolonged sitting with 1 hour of exercise. Basically, some of the scientists took all those markers, the high blood pressure, changes in heart rate, for someone just sitting static for 10 hours and then had them work out at a moderate intensity for 1 hour, and it did not balance out that effect. So long story short, like getting up and moving more throughout the day is one way to fix that. They estimate that 30 minutes of sitting can possibly reduce your resting metabolic rate by almost 90%. So less calorie burn throughout the day. And back pain is America's most common musculoskeletal problem, with about 1 of 4 people in the US suffering from that. And definitely that's like one of the biggest population types that we see here in our clinic for physical therapy. Some of the most common ergonomic injuries that we see quite often are carpal tunnel syndromes from typing or using the mouse, low back pain, like we just mentioned, wrist and finger tendonitis, and again, from that like mouse and keyboard usage, lateral epicondylitis, which is that kind of like commonly known more as like tennis elbow, and neck pain and any type of like joint syndromes in the neck. This is actually a population that we have seen a huge growth in over the last 2 years. You know, everybody went from this really nice ergonomic setup at work, you know, working downtown in Seattle, to all of a sudden they had to go home, you know, whether that was working in a very hard wooden kitchen chair or like slouching on their couch. We saw a huge increase in patients with just that generalized like neck and upper back pain. So hopefully some of the tips I give you will try to mitigate some of that. Some of the most common causes of back and neck pain that we see, I mean, first of which is just a poor ergonomic setup at home. Like I was mentioning, you know, think ground up, and we'll go over this in the next few slides, is, you know, where are your feet positioned? How is your low back position? Where is your head and neck? The second thing we often see, you know, one of the first things I ask all my patients is like, how much are you sitting throughout the day? You know, taking sitting breaks all throughout is probably the most important thing that you can do. It doesn't even have to be like a standing desk. It can just be simply getting up to get a cup of coffee, doing a couple stretches for 2 minutes. And then the third of which is a very stiff or locked up upper back, which is also called the thoracic spine, which is basically here more in your mid back. A lot of times patients who have a lot of low back pain from prolonged sitting will have a lot of range of motion restrictions in their upper back. And we generally like to look above and below the joint that's bothering you to see if that's the cause of your problem. So as most of you may know, you know, transitioning to a sit to stand desk, or at least having access to a way to go from a seated position to a standing position, is probably one of the best things you can do ergonomically and posture wise. A lot of the researchers say, you know, you don't have, and this doesn't mean you have to stand all day long. If you went, you know, you took me, for example, I stand for 8 hours a day, and you put me sitting 8 hours a day, there's that difference. Like, you don't want to, this doesn't mean you have to stand for 8 hours on your feet. You know, you're going to end up with sore feet, sore low back, things like that. They estimate like a 30 to 70% ratio is a good way to start. So that, you know, for a 10-hour workday, you'd be sitting for 3 hours, or sorry, excuse me, standing for 3 hours and then sitting for 7. It's also not very ideal to use a small laptop on a counter. You know, like those of you working from home, putting your laptop on your counter, you know, you'll end up just hunching forward, reaching forward. It's not very great for your shoulder position and your neck position. A lot of things that people don't think about as well is also, you know, wear proper shoes. At a lot of offices, the floor is like a tile or like a cement bottom. And if you're wearing heels or a not very, you know, more of like a slip-on shoe, they are not very supportive. And, you know, that can just end to just, you know, like low back strains and aches and things like that. So you want to make yourself as successful as possible. You know, if that's wearing a nice tennis shoe or something that gives you some good foot support. Your desk should also fit you. You know, your monitor should be right at eye level, and your shoulders should be able to relax. So if you pull up your standing desk and you feel like you have to look up or look down to see that monitor, you may have to get it modified a little bit, or at least, you know, put a couple books underneath your laptop or your space so that way you can make it fit to you. Here's a little bit of, you know, there's a lot more text on this slide, so I'm just going to talk through it a little bit. But as you can see in the picture here, the most ideal setup, like I had mentioned with the monitor, is pretty close to eye level. A good trick that you can do is if you just sit up nice and tall, good posture like you're sitting at your desk. If you close your eyes and then open them after about a few seconds, wherever your eyes are just naturally focusing is pretty close to where your monitor should be. So if you notice that you're having to look down or a lot more up, then you may need to change that a little bit. Wrists should be kind of in a nice neutral position like you see on the graphic there. If you have it cocked up or cocked down basically to try to reach the mouse or the keyboard like this, that can just end up with, aggravating your wrist and your forearm tendons a little bit. Also make sure to avoid having to rest your elbows on a hard surface. We get a lot of people, resting their elbows on their hard kitchen counters, ending up with some numbness, tingling into the hands, that kind of carpal tunnel that we were mentioning earlier. Taking visual breaks throughout the day as well, just a good thing for your eyes. It takes some strain off your neck. If you've been looking at something just a foot away from your face for, hours at a time, just picking something in the distance to look out to let your eyes focus on something else can definitely take a lot of that dizziness and just the eye strain out of your life there when you're working. And then something that a lot of people don't think about, I know we have access to earbuds a lot more now with, 21st century, but if you are somebody who works on the phone a lot, make sure not to have your head crimped to the side the whole time while you're using a phone or your cell phone, because that'll obviously end up with tightness or neck restrictions on one side. So using something Bluetooth where you can just move hands free is probably going to be a lot better for your posture over time. So some of these wrist positions we were talking about here. So this picture is a not ideal wrist position. I would say that this person's wrists are in about a 30 to 40 degree incline. And, for 1 or 2 hours of working at a computer, probably not a big deal. You probably won't feel any issue there. But for someone who spends, 40 to 50 hours a week at their computer, this may start to bug that person's hands, wrists, and forearm. So ideally, you'd want it at a little bit of a less angle, and it should be just a little bit extended. So just a little bit past neutral there. And that'll put a lot less strain on the wrist. Another thing that we look out for on this picture is no access to a footstool. If you're sitting, or a good example is a lot of people sit at bar stool or countertop stools and their feet dangle off the edge. And that's just going to tug your posture forward, tug on your low back a little bit. As you can see here in this picture, she's kind of slouched forward. And the more ideal position is just to have a footstool underneath your desk there. It could be all sorts of stuff. I've had people use cardboard boxes, books, anything like that, because it just basically props your low back into a little bit of a better position. And then, like I mentioned, bar stools, kitchen, wooden kitchen chairs. This is, what everyone's been having to use working from home. But over the long term, those are definitely not ideal and don't give you the postural support that you need. So having a desk chair, with some lumbar support, something that's adjustable up and down, like I said, feet on the ground, making sure that you're able to rest your arms and elbows on something soft. This will be a little bit more ideal in the long run. I know a lot of the big tech companies, Amazon, Facebook, they're most likely pushing their work from home until 2022. So if you haven't made any sort of modifications in terms of the chairs and such that you're using, and you see that you have maybe at least 6 more months of work from home to go, it may not be a bad idea to look into some of these. I would say the top 3 modifications that I give all my patients that will make the most bang for your buck per se is that footstool. It's super cheap. You could use anything around the house. A lumbar support, and we'll go over this in the next couple slides here. It can be a mesh kind of thing that you strap onto the back of your chair that you can get in any major store or Amazon, or it could even just be a pillow or a rolled up towel. And then a little bit pricier, but getting some sort of sit to stand desk, as you see this fellow here in the picture. That's more of a countertop sit to stand desk. The price has definitely come down on a lot of these. You can find some of them for anywhere around $100 to $300 just to put on your countertop. If you have gone back into the office and you're suffering from any sorts of upper back or low back pain, and you don't have access to this at work, it definitely may not hurt to reach out to your HR or your employer and ask to see if you can make any modifications that way. So we were talking about some of the inexpensive home ergonomics modifications. So Footstool, like we mentioned, is the first one. Could be anything, even just like a little step stool that you find around the house. Second of which being that kind of mesh lumbar support. This would be the most ideal. You can also use a bath towel kind of rolled it up, or 2 bath towels rolled it up. As you can see, the natural curvature of the lumbar spine is supposed to look more like a S curve like you see on the bottom there. And if you end up just like slouching and hunched forward, that can just put a lot of postural strain through all of your muscles and your low back tissues there. So this is something that you can use to mitigate that. Third of which is that sit to stand desk that we just mentioned. A Bluetooth ear device, if you're making lots of phone calls on your cell phone, a way lot easier to use that, less strain on your neck throughout the day. You know, you can pick up a cheap one anywhere $30 to $50 range would be a good investment for that. A lot of these mouse pads, a lot of times come with the mouse if you buy them. But if you do have a mouse that's just like standalone and you're using it at your desk, getting some sort of pad for your wrist, as you can see in that picture there, where this part just kind of sits and slots in the middle there, can take a lot of pressure, you know, so you're not having to put your entire forearm and wrist onto like a hard wooden surface, or like a hard desk is a good ergonomic modification there. And then third of which is an ergonomic keyboard. So like the laptop, I know you can't see, I'm using a very small Microsoft Surface, which is fine around the clinic. You know, I can move it around easily, but the keyboard is not very spaced out. My hands are very, very close together. And then basically it'll lead to just, you know, shoulders and upper back rounded forward. My hands have to be kind of like hunched and crinched forward. In the picture there, you can see it's a lot wider keyboard, because ideally your hands should just be kind of at shoulder level, spaced apart there evenly, rested at like that 90-degree angle. So getting an external keyboard for your desk may be something that really helps out your wrists and your forearms. Something that was coined, the Pomodoro Method, I forget which like Italian scientist created this, but basically what it is, it's a method of improving productivity and mental rest. Basically, some research has shown that in a 30-minute period, you should be working for about 25 minutes with a 5-minute rest break mentally. This was more geared towards like how to study for tests and so on and so forth. But we can use the same exact method to basically work on from sitting to standing, moving a little bit more throughout your day. I think a lot of my patients, they just struggle with, you know, trying to remember to get up. You know, they'll be at a meeting and then all of a sudden they're working on a document and 3 hours, 4 hours have gone by and they're like, oh shoot, I haven't stood up, you know, I haven't done anything today. So setting a timer on your phone or on your watch, I would recommend every 45 to 60 minutes, at least getting up once for a few minutes would be ideal to try to reduce that postural strain that, you know, that prolonged sitting can lead to, that we talked about earlier. And experts recommend to achieve at least 2 hours of standing in an 8-hour day. So that's pretty close to that 30 to 70%, you know, ratio that we talked about earlier. And, you know, setting your timer can just be something super simple, but a great way to mitigate some of your like postural stress or neck pain and things like that. So now we're going to get more into the like physical therapy side of things. You know, that's my job, and I like to throw in some of that flair into the ergonomics, you know, because the body's all about motion. Where you're weak or where you're restricted will lead to the issues that you're having. We had mentioned earlier not to neglect the thoracic spine, right? Whether you're dealing with neck pain or pain in your low back, your middle back, your thoracic spine is kind of like your keystone. If it's limited, tight, or weak, that can definitely lead to issues up and down the chain. So your back moves in 3 planes of motion. And as you can see here in the pictures, I'm going to kind of back up and demonstrate a little bit. Your upper back can move into extension and flexion, rounding forward and extending. It can rotate from side to side, and it can also bend from side to side. So if you're restricted in any of those three planes of motions, that can definitely lead to aches, pains, or stiffness. A great way, even if you don't have time to stand or walk around throughout the day, even just doing some easy chair or floor yoga is a great way to just get some sort of movement going. And we're going to go over some of these movements here in just a second. It does not have to be specific. All the time I get people asking me, like what specific stretch should I do, to mitigate X, Y, Z. And it does not have to be specific. I could sit in my chair and do some hand reaches back and forth. You could rotate your neck side to side 10 to 20 times each. Anything just to get your body out of a static position is going to be very, very helpful. So I do this one a little bit more. It works a little better in person, but you can follow along if you're watching me here live or at home, just to kind of do your own little screen for yourself. So the first thing that we're going to do is to test your flexibility in your mid-back in terms of twisting. So sitting up nice and tall, I want you to put both arms out in front of you. You're going to keep one out in front, and the other arm is going to reach behind you as far as you can manage there. And then you're going to try your other side. And I want you to do this about 2 or 3 times on each side and get a feel for just how your mid-back feels, the tightness from side to side. If you find that one is a lot more restricted than the other, it's a good sign that you may need to work on that. So the second one is the side to side, the flexibility kind of in your lats and your side body. Sitting in your chair, both butts down on that chair. You're going to reach across there as far as you can, and then go ahead and reach across the other side. Again, try 2 or 3 repetitions on each side. Get a feel for that tightness or stiffness. Kind of evaluate yourself, see where you're limited. And then the other one here is basically extension. So if you can see here, I'm going to back up in my chair. My back's against the back. I want you to reach back as far as you can. If you have a chair back, you can let it rest up against that. And you're just going to stretch and reach out there as far as you can. Try that 2 or 3 times and see how your back's feeling there. See how your neck's feeling. And then this is going to lead me into talking a little bit more about postural strengthening. Stretching is definitely great throughout the day, but what we see a lot of times is that more of muscular weakness can lead to just lack of endurance. For sitting does take some muscular strength, and we just see a lot of weakness leading to postural pains and aches. So we sit a lot throughout the day, right? Our chest, our shoulders are relatively rounded forward. If you're driving, that's a relative forward rounding position. So we want to get our shoulder blades back and down is really what we're shooting for here. So we give a lot of our patients, we call them pull exercises rather than a push up. It's more of a row pull against, whether you have TheraBands or dumbbells at home. There's even some easy body weight exercises that you can do, because that'll strengthen all the muscles up and down your spine, and then will mitigate some of that sitting throughout the day. You definitely, when you do these exercises, it does have to be difficult enough, where you're feeling some sort of muscle fatigue or soreness to improve strength. You can't just do just a few repetitions and call it a day. The American College of Sports Medicine recommends for postural or work from home, working out these specific muscles 2 to 3 times a week, 2 to 3 sets of each exercise that you choose, with about 10 to 15 repetitions per muscle group. So a good example of that is if I just did a kind of a standard row pull against a resistance band, I would do 2 sets of 15 with a good amount of fatigue, and making sure that the band or the weight that I'm using is not too easy. So here are some pictures here that involve those pulling motions that we were talking about. The gentleman on the right in the blue shirt is doing more of that just kind of classic row pull. TheraBands are really, really easy just to buy and just shove in a door frame. You can do all sorts of motions with them. The guy on the left here is doing more of a bent over row, working on some postural strength. The bottom 3 exercises here we call shoulders, I's, T's, and Y's. You can do them over a Swiss ball. You can do them laying flat on your stomach on like a yoga mat. And it's just going to work all of those mid shoulder blade muscles that just kind of get strained over the day. And then here are some examples of some stretches and some soft tissue techniques that you can use. First stretch over here, we talked about like the forward rounding of the shoulders, just kind of a classic pec stretch in your door frame. Letting all of this stretch out is a really great way to reduce some of that strain. If you have access to a foam roller, rolling up and down your spine, basically just to do some self massage. It's definitely never the end all be all or the long-term fix, but foam rolling can definitely feel great. If you're feeling very sore and stiff by the end of the day, 3 to 5 minutes of some rolling can definitely improve your pain levels there. And then the last one there is basically just a chin tuck. Same exact kind of concept, right? As if we round forward, let our head jut forward, that'll start to strain some of the structures in the neck here. So something as simple as just pulling your head and neck back. Sometimes I'll even teach people to use their hands to retract their neck. And you should get a nice little stretch somewhere along your upper back or your neck. And then just doing about 10 to 15 of these intermittently throughout the day can definitely help those of you with neck pain or headaches and things like that. What I would say is, light aches and pains, such as just some like upper trap tightness or a little bit of wrist soreness that goes away after a little bit after you finish a long day of work, I would consider that normal. If you're having a lot of pain that is chronic or unrelenting, neck pain that doesn't seem to go away, or like numbness and tingling in your hands from working at your desk, that is not normal. I would definitely go to your primary care provider to get checked out, go to your local physical therapist or your movement specialist to get checked out, because there may be some things, whether that's tightness or weakness that's causing your issue. And every individual is unique. Every exercise might not be right for you. The things that you saw in this presentation are generally safe for most, but getting evaluated by a specialist will get you to where you want to be faster. Like say somebody is super flexible. If you're a very flexible, kind of like a double jointed person, giving you a ton of stretching exercises is not going to help your issue, right? I'd want to give that person a lot more strength work. And this is just a blurb about PT. Research has shown PT to be far more effective than rest, medications, or surgery to reduce neck and low back pain that's associated with ergonomics or working from home at your desk. So definitely try the non-operational route first. There's definitely a little bit goes a long way. Like, don't wait. Pain is not normal. And yeah, that's my presentation there. Would have probably gone a little bit longer if we were in person and able to do some interactive work here, but does anybody have any questions or any follow-ups related to things that we just went over? Hear you. I think you are unmuted, or you're muted.
You'd think I've been doing this long enough. I'd remember to unmute.
I always forget.
So any recommendation on the best lumbar pillow for an office chair?
So I definitely, we get a lot of questions on specifics. There's definitely not like a specific brand that I can recommend or vet. If you were to go on Amazon or Office Depot, you would see, hundreds of different types. I know it's more of a cliche answer, but something that fits best for you. Everybody's larger, taller. I would try, instead of getting something super expensive to start off with, even just try, if you don't have like a pillow, even just trying like a couple bath towels or even just your own pillow to put there and see how your back responds to it. Basically, if you notice a good amount of back pain relief just by using a towel or a pillow, then you can go out and spend some more money, try to find what fits for you. But if you put a towel back there or a pillow back there and you don't notice much relief, then I would say going a different route would be a little bit more helpful.
I have a question, which is, I know for a little while, walking desks were vogue. Do you have any thoughts about them?
I definitely don't see anything wrong with them. I think the biggest barrier probably is just like price or like accessibility. But yeah, I think they're great. Movement in general is really what, the whole purpose of this presentation was about. Movement doesn't have to be specific. If you're able to, I have had some patients with those walking desks who don't use it as much because they can't concentrate as well. Like I know I can't read a book and walk on a treadmill. But if it works for you and you're just doing some like mindless tasks, then by all means, you would be burning calories and walking all day long.
Okay. Just curious about that.
Yeah.
Oh, and somebody had a question if they could get the slides, and I'm wondering if maybe you'd be okay with me putting it in an outline format, if that would be all right, and posting it with the video. And I'm not sure if the person wanted specific things from it. I generally don't share people's PowerPoints, but I don't know what your thoughts are.
I'm totally fine with that. Yeah,
Okay.
there's nothing real specific in terms of like company property, anything like that. You can totally print it out.
Okay, thank you. And let's see if there's other questions. The person who wanted the slide said, just the ability to go back and think about it and how to apply it at home. And I think, yeah, especially it had me thinking a lot about those specific joints, the picture with all the joints that you look at in that ergonomic assessment. Mm-hmm. And I can think of a lot of things that are probably a little bit off, that could contribute to other issues. So we have a lot of patients who get, have back strain or something that's happened more acutely. Mm-hmm. Do you have suggestions for them getting through a workday when maybe it is really, they're having a few days of really acute pain?
Yeah, definitely. If most of the time, if we see people for those types of strains or, they've injured themselves, that sitting seems to be the most aggravating position. So it's definitely like an unfortunate circumstance if you're having to sit for that long. I would say like getting up and doing, the standing or some specific stretches that makes them feel better. Usually people with a low back strain have a posture or like a position like, hey, if I bend forward or if I do, this X, Y, and Z movement, I feel better. Just to get up out of your sitting position and do that more throughout the day. Using an ice pack or a hot pack can also mitigate pain. The first step in that first, few weeks of a strain is just to mitigate pain a little bit and stay moving. Probably the worst thing you could do is just to stay stiff and to stay immobile. So yeah, like you were saying, they may not have access to a treadmill desk, but walking a couple blocks around the house every so often, doing a few stretches, using some, modalities like a hot pack or a cold pack, things like that can definitely help.
With the standing, I have seen, little waves of patients who try the standing and then it's like you were saying, gradually building up to it is probably a good idea. And the quick switch is, can, cause other problems. One thing that a surgeon taught me, if you're going to do that standing and you're not used to it, is leaning one leg into what you're standing against. So a counter or something like that, just to alternate that movement,
Exactly.
get different muscles helping out.
Yeah, and I didn't cover this in the presentation, but if you have that footstool that you saw like a few times, like propping your foot up onto the stool just to shift your pelvis back and forth intermittently can definitely help. And like you were saying, it's not as common, but sometimes people with back pain, like a spinal stenosis or a spondylitis, will not like this standing, as like sitting is their preferred position, right? So for them, it might be a little bit harder, and we might even go less, like, hey, try 10 minutes every hour or every 2 hours. So that way it's not as, not as traumatic for the back. But yeah, incremental progress. I don't expect anyone to get even close to 8 hours of standing in the day.
Absolutely. And there was a comment. Thank you for the presentation, Christopher. Thank you for the reminder to stand. I stood for the webinar and feel better. And I do recommend a floor mat.
Definitely.
You make a difference. Any other questions today? I can speak for everybody and say that was fantastic. It was detailed, yet a general overview for those of us that are less educated about ergonomics. And I really appreciate you doing this for our patients, and your office is within walking distance from our office, so our patients would easily be able to get there. And we're happy to send referrals for those assessments at any time.
Perfect. Yeah. Thank you for the kind words about the presentation. I appreciate it.
Thank you so much. We'll be here next month for a talk with a therapist about managing anxiety. And that's also going to be a great talk, and we look forward to seeing people there. Bye.